So now let's take a look at the second area that the International Diabetes Federation said was related to diabetes risk, and that's fetal origins. As we've said, we know that if mom is drinking or drugging during pregnancy, that's a real problem for the developing fetus. And as we will talk about some more, her mom's nutrition during pregnancy is also critically important, even more than we've ever known in terms of pregnancy. We talked about smoking. If mom, of course, has diabetes already by the time of pregnancy, that significantly increases the risk for diabetes in her offspring. But if mom herself was low birth weight, she is more likely to in turn deliver a low birth weight infant, holding everything else equal. And that doesn't seem to make sense until we're understanding this new science. And if mom is stressed during pregnancy, or even if she herself had adverse childhood experiences in her own childhood, she is more likely to deliver a low birth weight or preterm baby. So let's just remind ourselves of some definitions here. Preterm simply means being born before 37 weeks of pregnancy or gestation. And being low birth weight or small for gestational age simply means that no matter what gestational age you're born at, there are average weights. Whether you're born at 32 weeks or 38 weeks, there are averages for babies of that age. And these babies are born small for whatever gestational age they were born at. And you can be either or both SGA and preterm, or neither, of course, but they both increase that baby's later risk for chronic disease, as we'll see. Here's an example. This is a study that was done in moms who had depressive symptoms before conception and in the early parts of pregnancy. And they, of course, had what is the hormonal equivalent of depression, which is elevated cortisol and low serotonin and dopamine levels. Remembering that serotonin is the neurotransmitter that Prozac affects. Serotonin and dopamine are involved with feeling good and thinking well and going about your life in a good way. So this is the hormonal equivalent of depression. These moms were more likely to deliver their babies prematurely, and those babies were likely to be low birth weight, or SGA. The newborns of those moms themselves had the hormonal equivalent of depression, elevated cortisol and depressed serotonin and dopamine levels, just like mom, and they had the newborn equivalent of depression. In this literature, they call it suppressed neurobehavioral profiles, and all that means is that the infants were not as interactive or alert and all the other things that would correspond with infant newborn depression. And if you think depression in pregnancy isn't common, this study was actually done in an HMO, and HMOs tend to actually be filled with people who are white, middle class, and employed. In other words, folks who are less likely to have all of the struggles in life that many other people do. And despite being a lower risk group in this study, almost half of these pregnant patients had depressive symptoms, and half of those symptoms were severe. And the risk to deliver a preterm baby went up as the depression severity went up. This is a huge problem. Well, you might say, well, the babies will be fine once, now that they're no longer connected to mom through the placenta, those hormones of moms will wash out and the baby will be fine. Well, unfortunately, it doesn't work that way. The study looked at adolescent girls who were born to mothers who had significant anxiety during their pregnancy. And these adolescent girls had increased stress hormones and depressive symptoms. Now we're talking 15 years after they were exposed in utero to mom's anxiety and the corresponding hormones. So this is a huge issue. So we'll talk about back to diabetes then and this whole thing. This is a meta-analysis looking at studies around the world showing that there's an inverse relationship between birth weight and risk of diabetes. In other words, the lower your birth weight, the higher your risk of developing diabetes later in life. And of course, in our population, it was actually a U-shaped association, meaning it was your Native American patients were more likely to get diabetes both at lower and higher birth weights, as we'll see in a minute in terms of how much insulin resistance actually starts in the womb. So again, this is now another study looking at people who were born in Europe during the stressful times of the Great Depression and World War II, letting their early life experiences play out in terms of disease experience many years later. And in this large cohort of people born in Sweden during those years, both, whether you were born low birth weight, SGA, and or preterm, was both strongly associated with later developing diabetes. So you might wonder why that would be. Babies of obese moms, and this is obese moms, this isn't diabetic moms necessarily, these are just obese mothers, develop insulin resistance in the womb. This is from Diabetes Care from June. Maternal obesity creates a significant risk for the next generations with metabolic compromise already apparent at birth. So again, long before all of our nice prevention programs get started, children are starting out behind the eight ball, so to speak, with increased risk right at birth. And similar to the study we looked at earlier, in this study, rapid weight gain in the first 3 months of life is associated with risk factors for heart disease and type 2 diabetes by the early 20s. So something's going on in that prenatal life that is really bothering people and their risk and creating the risk for them for later in life developing diabetes and heart disease. And this is a term we don't usually use, fetal programming of type 2 diabetes. This is just from Diabetes Care a couple years ago, that the intrauterine environment may modify gene expression permanently, might be inherited transgenerationally, affecting the health of future generations. During intrauterine life, there are waves of epigenomic modification intimately associated with growth and development, and opportunities galore for environmental factors to influence these processes. A fetus thus programmed travels a path of limited options. That's pretty powerful stuff. So we're going to talk about this slide now because this is actually going to help us understand what's going on in the prenatal time. And this is from an article from just a few years ago in Physiological Reviews. So it's kind of hard to understand at first, so we'll just sort of talk through. There's kind of two things that are happening in pregnancy that we're going to talk about. The column on the left, substrate restriction, means poor nutrition during pregnancy and before pregnancy, actually, because a lot of the nutrition that goes to make up the baby's body actually comes from the stores that mother has in her own body. So that means her nutritional experience before pregnancy matters a whole lot as well. So on the left column is the substrate restriction or poor nutrition. On the right is going to be stress hormones affecting the pregnancy. So let's take that nutrition one first. And I have a simple mind. The way I look at this is this way. If you have a blueprint for a house, and you know the house you want to build, but you look and you see that you don't have enough bricks to build the house, and you can't afford to buy any more bricks, you have to make some choices. You have to either leave off a room so that you can have enough bricks to build the rest of the rooms, or you have to make all the rooms that you do build smaller. And in essence, that's what happens here. If there are not enough nutritional building blocks during pregnancy available to that growing baby, the brain gets first choice as always. But the rest of the body may not get what it needs. And as you can see on this slide, it often results in a decrease in cell number, meaning that it's not that the body doesn't make that choice not to build a room. It doesn't say, well, we don't have enough bricks, so we're just not going to build a kidney. Instead, it takes the other approach and builds smaller rooms so that there's a few less nephrons in the kidney, there's a few less liver cells in the liver, there's a few less beta cells in the pancreas to make insulin, there's a few less heart muscle cells, and so on and so on. If it's a little bit of a decrease, no big deal. It probably will never be a problem to that child, even once they get older. But the more that that occurs, the more that there's a decrease in the cell number can actually affect overall organ growth and even overall fetal growth, which is what we're seeing in the small for gestational age babies. This is a huge issue later in life, especially as we'll see. Then on the right side, if mom is stressed herself during pregnancy, or if her own stress hormone set points have been set so high because of her own previous difficult experiences in life, she's flooding that placenta with stress hormones. Now there is an enzyme in the placenta that can buffer some of that. So the normal bumps of pregnancy are not a big deal. That cortisol will not be a problem for that baby. But if mom has a lot of stress hormones flowing around, it's going to be a big problem because that enzyme gets overwhelmed. It does go across the placenta, and that cortisol and other hormones do then change the set points. The way I think about it is If you're building a car and you're working on the gas system, if you have something that is making you rev that engine faster for the rest of your life, every time you hit the gas pedal even a little bit, you're going to get a whole lot of gas flooding the system and an overworked car. And that's basically what happens here is while these set points for this unborn child are being set, if there's a lot of hormones coming from mom, then that child becomes cortisol resistant, just as they can become insulin resistant if mom has a lot of insulin floating around because she has trouble with glucose. So I know it's a little hard to understand to some degree, but those are the two areas. Decreased nutrition resulting in poor fetal growth, including at the organ and cell level, and a whole change in set points of a lot of things in the body, including the way we respond to stress. You put those two things together in those 5 boxes in the middle. These two things combine then to decrease the ability to synthesize insulin. It increases, because cortisol does this, it puts out, this child will put out more glucose from the liver. And it's said that the brain gets first choice of nutrition, the organs get second choice. What often gets the short shrift most of all is developing skeletal muscle, because the body figures, well, we can live without some of that most of all. Now, you might say that's not such a bad thing. Okay, this child won't become the next Olympic decathlon champion, but it's more than that. Muscles are actually, one of the best ways that we burn glucose. So later in life, if we have less skeletal muscle to use the glucose that we have floating around, it's just one more risk factor for diabetes. And we also see that there's a decrease in the heart and the liver's functional capacity right from the get-go, and that box on the far right shows us that there's changes in the stress or HPA axis hormones and things that regulate growth and appetite. And now, you're not even born yet, and those things are already in place. So then, as you can see with those darker boxes toward the bottom, now this child is born, and there's enough macronutrients, there's enough carbohydrates and fats and probably protein, but this child comes out now starving. Those cells are starving, and this is where that catch-up growth happens in the first few months to a year or so of life. The child comes out at the beginning, start with increased insulin sensitivity in these starving cells, so eats more, the growth catches up, but you can never create cells in an organ in quite the same way after birth as you can during those key developmental times in the in utero period. So you never quite make up for what happened in those organs before birth. The amount of cortisol floating around, we know that cortisol puts fat in the worst place, which is abdominally or in the visceral area. And you can see that as time goes by, all of this combines to decrease the kidney's function, to create obesity, and then finally at the bottom, some years later, this combination of heart disease, obesity, and diabetes. So what happens in the prenatal period matters a lot. So we now know, actually, as I said at the beginning, that what happens to your grandparents affects your risk for diabetes mortality. And some fascinating studies coming out of Sweden about this, but they're clearly showing that when your parents and grandparents were in the womb themselves, that's when the eggs are created when a woman is in the womb herself. So what's happening to her mother then affects the eggs she creates that she will then pass on the epigenetic markers for. Sperm is created before puberty. So what happens in late childhood affects the sperm epigenetics that gets passed along. So it's interesting stuff coming out on how at least 2 generations back what affected them affects us. So we talked about how these epigenetic changes in the egg and the sperm are passed on. So it not only matters what happens to our mothers, but it also matters what has happened to our fathers and grandfathers. And this just sort of summarizes what we've been talking about, is that prenatal undernutrition and or psychosocial stress creates all those things we've talked about, that maternal cortisol can be reduced by the placenta, but this gets overwhelmed when there's lots and lots of stress hormone around. And that reduce cell development, even including overall fetal growth when there's insufficient nutrition. And that the stress hormones themselves actually constrict the blood vessels going to the placenta and can lead to a preterm birth all by themselves. And as we've said, that if mom has a lot of stress hormones floating around, it changes those set points for the baby's own stress hormones for the rest of its life. And there's a thought that this might be adaptive prediction, meaning that if mom is stressed, then the baby is probably coming out into a difficult world and needs to be ready for that, and that it might be actually to the baby's advantage to be a little more stress reactive, a little twitchier, a little more hyper alert in such a circumstance. So possibly that's an evolutionary kind of adaptation. And I told you earlier about a study in rats looking at if rats pups were born to a nurturing or not parent, that it affects a gene which affects our stress reactivity. This has now been shown in humans in this study that was published a few months ago in Nature Neuroscience, that early life exposure to parental behaviors, nurturing versus abuse, creates epigenetic changes in stress reactivity for the rest of that person's life.